Good day, students. Let's start lecture number 2 for first year for Faculty of Medicine. Name Modern Methods of Treatment of Fracture, Bone Regeneration, Osteopenia, and Osteoporosis. Definition. A bone fracture is a complete or partial violation of the integrity of the bone under a load exceeding the strength of the injured part of the skeleton. Fractures can occur both as a result of a trauma and as a result of various disease accompanied by changes in a stretch chassis of bone tissue. Classification. Original. Congenital. Accurate. Due to occurrence, traumatic cases by external influence. Pathological. Reason with minimal external influence due to the destruction of the bone by some pathological process, for example, tuberculosis, tumor, or others. According to the point of application of force, strengthening direct fractures by the severity of the injury full without displacement, for example, under the periosteum, with displacement of fragments at an angle along the length, along the width, or lateral displacement along the periphery of rotational. Incompleted cracks and breaks. According to the shape and direction of the fracture, transverse, the fracture line is congenitally perpendicular to the axis of the tubular bone. Longitudinal, the fracture line is congenially parallel to the axis of the tubular bone. Oblique, the fracture line runs at an acute angle to the axis of the tubular bone. Screw-shaped, there is a rotation of bone fragments. Bone fragments are rotated relative to the normal position. Comminuted, there is no single fracture line. The bone at the site of damage was shattered into the separate fragments. Wedge-shaped usually occurs with fractures of the spine when one bone presses down on another, forming a wedge-shaped deformity. Impacted bone fragments are displaced proximal along the axis of the tubular bone or are located outside the main plane of the cancellology bone. Compression. Bone fragments are small, clear, there is no single fracture line. The integrity of the skin. Close, not accompanied by wound of tissue, penetration to the fracture site, and don't communicate with the external environment. Open, gunshot and non-gunshot. Bone fractures accompanied by soft tissue wounds and communicating with the external environment. Primary open fracture. The skin in the fracture zone is damaged from the outside by a traumatic agent. Secondary open fracture. The skin in the fracture zone is damaged from the inside by bone fragments. Single. If one fracture of one segment of the musculoskeletal system. Multiply. In the fracture is within one segment or different segments of the musculoskeletal system. According to the location of the fracture, regional, detachable, perforated, according to the localization of the tubular bone, epiphyseal, metaphyseal, diaphyseal. Complication, complicated. Primary early complication, traumatic shock, fat embolism, displacement of the bone fragments, damage to the main vessels, bleeding, and peripheral nerves, primary microbial contamination of the wound. Secondary early complications, secondary displacement of the bone fragments, secondary open fracture, damage of the to the main vessels and peripheral nerves, secondary microbial contamination of the wound infection, osteomyelitis sepsis. Secondary late complications, improperly health led fracture, delayed union, false joint, traumatic osteomyelitis, muscular atrophy, joint stiffness, for Volkmann contracture, Zudeck's syndromes, acute trophonephrotic bone atrophy, traumatic shock, and uncomplicated. Classification of our fractures. The three types of fracture called A, B, C. Each type is divided into three groups, A1, A2, A3, and so on. Each group is divided into three subgroups, designated by numerals 1, 2, 3. A1 means a simple fracture with a good prognosis, and C3 is the most complex fracture with a pure prognosis. For example, humerus, there is number 1, radix and ulna number 2, femur number 3, tibia and fibula number 4. The second definite the bone segments, proximal number 1, diaphysis number 2, distal part number 3, ankle malleolus number 4. The next letter then defines the type of fracture for the diaphysis segment. A, simple, B, wedge-shaped, C, complex. For the proximal and distal segments, A, extra-articular, B, incomplete, C, full joint. There are three exceptions. The proximal shoulder, A, extra-articular unifocal, B, extra-articular bifocal, C, extra-articular. Proximal femur, A, trochanteric zone, B, neck, C, head. Ankle segment, A, subsyndesmotic, B, transsyndesmotic, C, suprasyndesmotic. For example, symbol for the trochanteric fracture 3-1-A2-L. 3 femur, 1 proximal segment, A2 trochanter zone comminuted, L1 intermedial fragment. Bone strength 4 main stage of the regeneration. Autolysis in response to the development in injury, edema develops. Acute active migration of leukocytes, autolysis, and dead tissue occurs. Reaches a maximum by 3 and 4 days after the fracture, then gradually subsided. Proliferation and differentiations, active reproduction of bone tissue cells, and active production of the mineral part of the bone. Under adverse conditions, cartilage is the first formed, which then minerals and is replaced by bone. 3. Restructuring of bone tissue. The blood supply to the bone is restored. Compact bone substance is formed from the bone bones. Full restoration of the bone marrow canal, oriental of the bone beams, in accordance with the force lines of the load, formulation of the periosteum, restoration of the functionality of the damaged area. 4 types of callus. Periostal, slight thickening of the formed along the fracture line. Endostal, the callus of the located inside the bone, a slice of decrease in bone thickness at the fracture site is possible. Intermedial, the callus located between the bone fragments, the bone profile is not changed. Parosteum surrounds the bone with a sufficiently large protrusion can distort the shape and structure of the bone. Morphological stages of reparation, bones tissue regeneration. Stage 1, the beginning of the development of reproduction and proliferation of cellular elements under the influence of products of necrosis and necrobiosis of damaged cell and tissue. The main importance in the formulation of callus is the restoration of blood circulation in the area of the fracture. Stage 2, formulation and differentiation tissue structures. It's characterized by progressive proliferation and differentiation of the cellular elements, which occupies due to the anabolic hormones. Young bone cells form the organic basis of the bone regeneration. Under optimal conditions, blood immobilization, good immobilization, absence of the contaminated disease, osteoid tissue is formed. Stage 3, the formation of the bone structure. The main process is the complete restoration of the blood circulation at the fracture site and the mineralization of the protein base of the regenerate. The space between bone fragments is filled with a small celled network of bone trabecular made of coarse, fibrous, and lateral bone tissue. By the end of the stage, the bone trabecular merge into a compact substance with weight bone canals. Stage 4, restoration of the primary regenerate and bone restitution. At this stage, a clear cortical layer is determined, the medullary canal is restored, and the periosteum is clearly differentiated. The chaotic arrangement of calcified structures is replaced by T-orientation, excessive stratification of the regenerative. Three types of reparative bone tissue regeneration. According to the type of primary fusion, according to the mesenchymal type, they form lamellar bone tissue. According to the type of primary delayed fusion, the small type with a partial fusion in the area of vascular changed urine intracanal osteogenesis. According to the type of secondary fusion of fusion endochondral type, with the formation of a massive bone regeneration, bone callus. Phases of osteoreparation in secondary fusion. Phase of early post-traumatic change, regeneration phase, a phase of functional adaptation. Morphological changes in a callus are characteristic by the following clinical signs in 4 stages. 1. Primary soldering and gluing of fragments. This is 3 and 4 to 5 days after the fracture. Fragments are mobile and easily displaced. Correspondence to the ones and the beginning of the two stage of the morphological restoration of the bone. 2. Fusion with the soft callus within 10 or 50 days. Correspondence to the beginning of the stage of the morphological restoration of the bone. 3. Fusion stage bone adhesion of fragments occurs 30 to 90 days and corresponding to 3 to 4 stages of the bone restitution. Clinical signs are lack of elasticity and painlessness when force is applied. Immobilization can be removed one after radiography. Functional restitution of the bone corresponds to the fourth stage of its restoration and lasts up to and more than a year. X-ray signs of corns in the form of tender cloud-like foci of calcification appear in adults at 3 to 4 weeks, and in children at 7 to 10 days after the fracture. The fracture line displays after 4 to 8 months. During the first year, the callus is modeled. The radiological beam structure of the bone appear after 1.5 to 2 years. Osteosynthesis. Osteosynthesis is a method of correcting bone fragments by their prompt exposure and fixation with various materials: metal, plastics, bone grafts, synthetic materials, and etc. Osteosynthesis does not complete by only complements of exciting methods of conservative treatment. Internal osteosynthesis, plate osteosynthesis, intraosseous intermedullary osteosynthesis with pin nails of Kuncher, Bogdanov blocking pins. Intraosseum osteosynthesis with screw cerclage wire, knitting needles. Osteosynthesis with titanium nickelidide implants with shape memory. Osteosynthesis with transpedicular constructions for fixing the damaged segment of the spine. For example, extrafocal osteosynthesis using the need apparative of Ilizarov, Gudushauri, Demyanov, Kaunders, Tkachenko, Sivash, Volkov, Aganesian, with the help of the Erod apparative, with the help of a spur rod apparatus. Using submersible implants and external fixation apparatus. For example, linked pin and extra fixation. Local reasons. Unstable factory reposition of fragments. The use of too large load in skeleton traction. Incorrect and insufficient, often interrupted immobilization. Excessive early use passive gymnasts. The degree of tissue trauma in the area of the fracture and crushing of the soft tissue, muscular shirts surrounding the bone. At the fracture line, the blood supply of which is inextricably linked with the blood supply to the bone. Infection complication, loss a result of trauma of large bone fragments or their removal during PST. Localization of the fracture in the epimetaphyseal or diaphyseal part of the bone. Interposition in the area of the fracture. Propioneurotic disorders. Peripheral nerve damage, local purulent infection. Terminal osteosynthesis. Terminal osteomyelitis. Contract of the area of intra-articular fracture with the synovial fluid. Multiple bone fractures. Completed damage. General reasons. Avitaminosis and hypothyminosis, screwing rickets, osteomalacia of pregnant woman. Violation of the functional of the parathyroid glands, decrease in the content of calcium in the blood, and hyperfunction of the adrenal glands. Chronic disease, tuberculosis, syphilis, diabetes, mellitus, syringomyelia, tumors of the brain and spinal cord. A showdown in bone degeneration is also noted in anemia, cachexia, and radiation sickness. Long-term use hormonal during hydrocortisone, prednisolone, and so on. Habitus intoxication. Form of violation of reparative process. Delayed fracture union is a change result by the past average period of fracture consolidation. The presence of mobility, springiness in the fracture area. Weak radiographic signs of union and the absence of symptoms of pseudoarthrosis. And ununited fracture is characteristics by the mobility of the fracture zone after twice the average time required for the consolidation of the fracture of this localization, and there are no symptoms of pseudoarthrosis radiologically. The false joint is distinguished by radiologically determined isolation of the bone marrow canals of fragments, sclerosis of their ends, and the presence of a gap between them. False joint, hypertrophic, hypervascular, hypertrophic, hypovascular, atrophic, and defect pseudoarthrosis dangling false joint. Delayed consolidation treatment. Conservative treatment, plaster, bandage, orthopedic devices, arthrosis. Introduction between fragments with a trick needle of 10 or 20 milliliters of the autological blood of hydroxyapatite colapan. The use of anabolic hormones, androstenolones, retabolins, and so on. Physiotherapy, electrophoretic of calcium salts, anabolic hormones, and so on. Electrical stimulation with weak currents. Turner methods, it's very old, now don't use. Surgical treatment. Back tunneling operative. Extrafocal compression osteosynthesis. Sliding graft surgery according to the Khachutov. Bone all and autoplasty according to Femister. Operation similar to Russian castle. Osteosynthesis with bone grafts. Osteopenia, a condition with in which there is a decrease in the bone mineral density and bone mass. Reasons for the development of the osteopenia. Female, the onset of menopause, which causes a series of hormonal changes that affect the system of the bones. Around physical race, long-term use corticosteroid, smoking and alcohol abuse, sedentary in lifestyle, diet pure in calcium and vitamin D, consumptions and carbonated drinks such as cola. Eating disorder and or metabolism and disrupt of absoluting of nutrients in the gut. Chemotherapy for mailing of tumors. Exposure to ionizing radiation. Treatment of osteopenia. Diet. Adequate diet intake of calcium and vitamin D. The best sources calcium dairy and so milk products, leafy vegetable, and especially fortified food such as cereal, mostly bread and juice. Vitamin D is found in the egg yolk, fatty fish. This vitamin is formed in the skin under the influence of sunlight, so sufficient exposure to the sun necessary. Osteoporosis, from osteobone and the Greek poros, whole time. Rarefactions of the spongy and cortical layers of the bone due to the partial resorption of the bone substance. For example, normal and osteoporotic. Osteoporotics, type osteoporosis. Spotted, uniform, local, regional, common system. Causes osteoporotic, postmenopausal osteoporotics, senile osteoporosis, corticosteroid osteoporosis и secondary osteoporosis. Change in the posture of osteoporosis. Diagnosis of osteoporosis, X-ray of bones, spine, osteodensitometry, dual energy X-ray densitometry, DEXA, normal T -1, osteopenia T between -1 and -2.5, osteoporosis T less than -T2.5, stabilized osteoporosis T less than -2.5 with the presence of the non-traumatic fracture. Treatment of osteoporosis. Etiological therapy is necessary to treat the underlying disease that led of osteoporosis. Pathogenetic therapy, pharmacotherapy of osteoporosis during with pseudominance separations of the bone resorption, natural estrogens, calcitonin, dysphosphonated pamidronate, alendronate, zoledron acid, and so on. During taken for a long time, 4 years. There is a difference in taking drugs. 1 week ribis, for example, and 1 of a month Bonviva, 1 year Aclasta. During that stimulation bone formation, salts of fluorines, calcium, strontium, vitamins D3, bioflavonoids. Symptomotherapy, removal of the pain syndrome. Complication of osteoporosis. For example, fracture of neck, femur, fracture of spine. Diet for osteoporosis. For example, milk, so therapy exercise for osteoporosis. Physical activity should include walking, which gives a lot on the bones. Swimming doesn't contribute to stretching of the bone side, vegetative-less state of a body in water doesn't lead to the necessary erosion of the bone structures. Thank you very much for the attention.